how important is oral hygiene really? It's statistically shown that most people don't know proper brushing techniques when it comes to their own personal oral hygiene. So what would happen if someone stopped with their oral hygiene altogether? I'm talking no brushing, no flossing, no mouthwash. Let's find out. Hello and welcome back to another One Mission DMD video. If you're new here, my name is Deham and I am a third-year dental student at ASDO, aiming to make your journey in and out of dental school a success while learning a thing or two along the way. So if any of that sounds interesting to you, be sure to like this video and subscribe for future content. Timestamps for the video are going to be right over here, so feel free to scroll along through any parts of this video that you think are going to be most beneficial to you. So we're all aware of basic oral hygiene instruction. When you go to your dentist, they're going to tell you to make sure to brush twice a day, make sure you're flossing, and make sure to use mouthwash. Sounds simple enough, right? But for those that only brush their teeth about once a day or not as regularly as we should, I'm sure you're used to that coating and film that you can feel on your teeth, especially on your tongue side of your teeth. That's called plaque. This is pretty much an accumulation of all the bacteria and food particles that are left over on the surfaces of our teeth. And if the proper mechanical removal of this plaque is not done, it can really lead to a lot of problems down the road. Now, when most people think about plaque, or if their dentist or dental hygienist tells the patient, hey, you got some plaque going on, people typically assume that it's just on the back or lingual part of their tooth, or the front or the facial part of their tooth. Most of the time that's correct, but another region people typically forget is the part in between each tooth, which is called the interproximal region. This is the region that is tackled mostly by flossing, because when we brush our teeth, we can't typically get into the areas in between our teeth. And that's why dental providers and dental hygienists or anyone in dentistry really enforces that flossing is absolutely essential. Managing plaque can be difficult enough, but if you are a person that has maybe not so straight teeth, then it's even more important because the plaque and the buildup of bacteria in between your teeth can be quite difficult to take out if you aren't regularly flossing. Now, this is one of the reasons we're instructed to brush twice a day with toothpaste. Technically, if we were to brush twice a day and floss and use mouthwash but not use toothpaste, you probably won't have cavities, but you will definitely have bad breath. It's this mechanical motion of the brush physically rubbing up against our teeth to make sure that the plaque is effectively being removed along with the bacteria. So what would happen if we left the plaque on our teeth? Well, over time, the plaque would continually be adding up and eventually leading to tartar and calculus. So basically all of the sugars in the foods that you're eating and in your saliva are just accumulating over and over and over and over, that now you're having this solid mass that gets stuck around your teeth and in between your gums. So the gums are very important when it comes to oral health because they are pretty much hugging up against our teeth. And when we have calculus and tartar and plaque being built up, we have this layer just, hugging up against the teeth. And now the gums start to realize that, and the gums start to become very unhappy. This is what leads to gum inflammation, or the swelling of your gums when they start feeling puffy, and can also lead to a lot of bleeding. This ultimately is what leads to the diagnosis of gingivitis. Now, what is that? Gingivitis is basically the inflammation of our gums, which leads to bleeding, all because of the plaque, tartar, and lack of oral hygiene, which is really just making your gums very unhappy because they're not able to hug up against the tooth. The most important thing that we learned in dental school is that gingivitis is reversible through proper oral hygiene and other dental procedures that can be done to make sure that gingivitis is dealt with. Basically, left untreated, it would lead to progressive worsening of your oral health. It could lead to periodontal disease or periodontitis. Now, what is that? Basically, the bacteria in your mouth are multiplying and growing and intensifying and not only eating away at your teeth right now, but making your gums unhappy and soon can start eating away at your bone. And this is something we are also taught in dental school, that periodontitis, unfortunately, is not reversible as gingivitis is. It can definitely be managed and mitigated through proper periodontal therapy, but we simply cannot reconstruct bone that is being eaten away and leading to deeper pocket depths. So again, paired with the lack of oral hygiene and lack of treatment, all of this stuff with periodontal disease can lead to bone loss and eventual tooth loss. And that's exactly what your dentist or your periodontist wants to prevent when it comes to your oral health. So that's probably it, right? If you don't have teeth, you're probably gonna have dentures and that's it. It's not gonna affect you anywhere else in your entire body, right? Wrong. With all of this bacteria accumulating, it can actually lead to bacteria entering into your bloodstream and attacking your organs. We learned in school, there's studies done about this, that if someone gets periodontal disease, they're more likely to get diabetes and chronic kidney disease. There's also been research that's shown that if someone gets periodontal disease, they'll be more likely to suffer with dementia later on down the road. There's also a risk of developing many types of cancers, including pancreatic cancers, esophageal cancers, oral cancers, as well as gastric cancer. Basically, at the end of the day, your personal oral hygiene is something that you decide for yourself. It not only affects your overall oral health, but your overall systemic health as well. I love this quote and I've heard it a lot, and it kind of goes around in dentistry a lot. You only have to brush the teeth you want to keep. With that said, I hope you guys were able to learn a thing or two from this video, and I'll catch you guys in the next one. Peace.